Hi.
Hello, Prof. Hello.
Hi, can you hear me?
I can hear you. Can you hear me, Prof?
Can you hear me? Yes, I can hear you. Thank you.
Amazing. I just wanted to introduce you. Can you see us or not? I don't know whether can you see us?
I can see you. Yes,
You
I
can
can't
see
see
me.
the
Okay, good.
audience. The
Hello. Hello.
yes, yes.
So I just wanted to introduce the Prof. I found him by accident at a children's birthday party. His twins are in the same class as my daughter, and we were just by chance we bumped into each other, and that was coming up to about 2 years ago, and since then we've kind of been inseparable. He is a very, very highly experienced, internationally renowned ocular plastic surgeon. He's an previous obviously ophthalmologist, so this is a person who's an eye doctor who then specializes in and has done separate certification for specifically for cosmetic surgery around the eyes. He's just recently got his professorship in the last 2 weeks, so congratulations, boss. And he does all of the oculoplastic work at my clinic in Leeds. So we do a range of different procedures in the clinic, including upper lid blepharoplasty, lower lid. He does SOOF lifting, he does brow lifting, he does direct brow, trans-bleph, and also he does the pretracheal through the hairline as well, all under local anesthetic. And he has incorporated NeoGen quite readily across the board with a lot of the different procedures to try and optimize the outcomes that we got for our patients. So without further ado, I wanted to introduce the Prof. Thank you so much for, he was doing a list, so really, really appreciate you taking time out. And I'll hand it over to you, boss. Thank you.
Thank you very much for your very kind invite, Dr. Raj. It's an absolute pleasure to be here. Big thank you to the NeoGen and to all the delegates who are here. Thank you for being there. I'm sorry I can't be there with you because of logistical challenges I'm operating today. So I wanted to share with you and take you on a journey of NeoGen and how NeoGen has now has enhanced my practice. If for whatever reason, I don't have NeoGen, I don't do my surgeries, at least my bullet blephs. So that's how much I've taken on NeoGen. So without further ado, we'll talk briefly about blepharoplasty. It's basically a procedure where we do contouring of the eyelids and the eyebrows. It's not just about removing the skin. And the surgical part of it is excision as well as fat transposition to give it the right shape. However, we need longevity, we need supporting tissues, we need the periocular tissues to do what they're meant to do. Thank you. Yes, thanks. No, thank you. Now, the challenge that all the blepharoplasty surgeons would have is that after the surgery, you've done a fantastic surgery, but periocularly there is fine wrinkling, there is some skin laxity, there's a texture quality issue, the forehead is not behaving the way we want it to behave. And I found NeoGen to bridge that regenerative skin technology that I was looking for. So, and whilst NeoGen is a very good procedure, I just want to make sure that it is safe, and it is safe. And I'm going to share some of my experiences to show the areas that you might want to avoid, and I'll give my logical reasoning behind it. So hopefully by the end of this session, you'll understand how I think about NeoGen role in periocular rejuvenation, identify safe zones and high yield treatment areas, learn practical pearls for combining surgery with NeoGen for those who may want to do that, and recognize the post-op benefits, including improved healing and reduced irritation. So we do know that it causes skin tightening, which is very important. The skin around the eye is very thin. It's only 0.5 millimeter. And when it stretches, it wrinkles very, very quickly. And when that wrinkle does not move further, it becomes a passive wrinkle, which is a problem. We also know that applying NeoGen has an antimicrobial effect. Sorry, it has an antimicrobial effect, which obviously is good. We don't want infection in our patients. And of course, the tissue remodeling. Dr. Raj is going to demonstrate the procedure, and I believe we also have Angela speaking later, who will talk about how she uses the scaffolding technique that I now incorporate in all my surgeries. It reinforces my lift during the healing phase. Most of us are aware of the mechanism of action, that it works on collagen 1 and 3, it does resurfacing, angiogenesis, helps with the elastin. This is just a simple cartoon of what the eyelid looks like in a cross section. So I'll go back to that. Oh, sorry. So when we look at this cartoon, which is on the right side of my screen, you can see that there is a red color, a yellow color, and a green color. The red color is orbicularis muscle in front of a plate known as a tarsal plate, and hence it's called pretarsal orbicularis. The yellow is in front of the orbital septum, and hence it's called preseptal orbicularis. Now, the pretarsal orbicularis is a very delicate tissue, very sensitive tissue, and it's very challenging to get it right. Most of our folds and the eye hooding that we see is at the preseptal level. So the blepharoplasty will sort out the preseptal issue, whereas blepharoplasty often will not address the pretarsal issue, and this is where NeoGen can come in, along with helping with the preseptal orbicularis issue. So the main tightening target is always preseptal skin, going back, this yellow part, but we can't ignore the red part either. Now, an upper eyelid hooding or dermatochalasis often has some brow descent, and that requires vertical vector correction. You can do that surgically, which is fine, but now we have other tools where in a mild to moderate level, you don't really need to operate on them. You can use other tools like NeoGen. And we do know that surgery alone does not improve skin quality. Skin is the most important tissue over here, and we can't ignore that in our surgical approach. Few polls over here. I use it in all my upper bleph surgeries, all my brow lift surgeries, whether they are transbleph, direct, or pretracheal, which means below the hairline. During surgery, I always apply them above the pretarsal zone because that's the contraction I need. You have to avoid lash line because of multiple reasons, not just loss of eyelashes, but also the architecture of the eyelash is important over there. Of course, we've operated and we don't want any weakening of our sutures, and therefore we don't want to apply any any heat base or plasma over the sutures. Now, the last point is not a NeoGen recommendation. That's just my experience that when I'm around the eye, I keep my nozzle about 2.5 to 3.5 millimeter above the periocular region. And I had a very nice conversation with Simon about this, who was quite curious. And I told him it's purely my own observation that I found when the nozzle is in that area, at that distance, I have personally found the skin to react the best. I've tried it close to the skin, I've tried it at a higher distance, but I just find that to be the most accurate, the most effective height at which it works. So surgery does the mechanical repositioning. NeoGen helps with the vertical vector tightening, and I'll show you some examples what I mean, and I'm fairly certain Angela later will talk about this as well. When I combine these two techniques, I have an enhanced brow elevation, I have a smoother skin contour, and obviously I have happier patients. So this is my immediate post-op and a few weeks later, and you can see the area in between the eyes, the glabellar area. You can look at the forehead, can see the symmetry over there. I should have really put a pre-op photo there, but I don't have it, I'm sorry. But over here, you can see the difference. Again, look at the glabellar area, look at the brow area, look at the forehead. We've taken care of the skin, but the brow fat pad, which had descended, is in the right place now. Just the face looks very nice overall. Again, here we've done the upper eyelid bleph, we've done the brow ptosis repair, we did fat transposition, we applied exosomes that I do with all my procedures, and we use NeoGen. And the result speaks for itself. Again, here we have upper eyelid, brow lift, pretracheal. Again, the difference is right there in front of you. Same thing over here. See this young lady who had a droopy eyelid ptosis because I've done my eyelid. I can't ignore the skin. And although she's young, you can see the difference in how it looks both pre and post-op over here. Once again, look at the area between the eyes, the glabellar area, the forehead. The overall quality really is better for me as a surgeon, and of course for my patients who are very happy. Another example of pre and post-op, you can see how lax the skin was. She's got brow tattoos, and therefore it was a bit challenging to get things in the right order, but with the combination of the surgery, the exosomes, and the NeoGen, we were able to do what we did, and the patient is extremely happy. Another example, here you can see a result. She's again a wonderful patient, a solicitor by profession, high stakes, was getting married, really happy with the outcome. So that's all very nice, and we want all of our patients to be happy. And this is where I'm going to take a slightly different direction and talk about what I believe is a no-treat zone. This is, again, not a NeoGen recommendation. This is just my logical reasoning as an oculoplastic surgeon who wants to do no harm to his patients, as I'm sure you do as well. On the inner side of the eyelids, we have openings for a canal. It's a small, tiny tube, both on the upper eyelid and lower eyelid, where you see as C and B on the cartoon. And they're called canaliculus, and they drain the tears from the eyes. The lumen is 0.2 millimeters. It is extremely superficial. The depth from the skin is less than 0.5 millimeter. They can easily be injured. And in my logical view, if there is any excessive inflammation in that area, my tear ducts can get blocked, which would result in epiphora or watery eye, streams down. And the treatment of that can be extremely challenging. And sometimes you have to create a bypass surgery under general anesthesia. It is only that area that personally I avoid. And I'll show you a video of how I do that. So this is a video of, sorry, the lacrimal puncture right there. And just above this, where the lid margin is, that's the area you need to avoid completely. Everything else is safe zone. Want the price for please? Thank you. And then over here, it's like a mound all the way going inside the hollow area. You need to avoid this. And everything else is under the bone, so you're okay. But this is very superficial. The last thing you want to do is damage this area, okay? So you can see this puncture is 0.2 millimeters. And similarly, sorry, have a computer, please. Okay. So that's a puncture right there. And you can almost sense there's a tube going on over here. So as long as you can avoid. I remember this is post-surgical eye, which means that there's a lot of swelling. So we need to be slightly even more conservative. Okay. Very small. Very small. Right, so going through this again. You can see there's a puncture right here. This is a lid margin. Oh, right here too. Oh, right. There's a tube right here. So going above, over there. So everything else is safe to treat. Because of my wound, I'm not going to treat here. So I'm going to treat on the top right there. Otherwise, I would love to treat this area as well. But because of this surgery, I've already tightened it. I don't want more tightening at this stage. I can do it later. Okay. Okay. Our position is good.
Yeah.
That suture is just holding things for us.
Well, the one at the top of the,
These ones.
yeah.
They'll hold it for a couple of weeks and then we'll remove
Yeah.
them. Okay?
Perfect.
Good. Congratulations. And you're closing your eyes as well. Good.
Yeah. Ooh, or
Our position is right. So blepharoplasty increases dry eye risk. In my experience, and that's an area of interest of research for me, I believe, and this is anecdotal only, when I apply NeoGen on the eyelids, the dryness, the dry eye complaints reduces for the patient, and there are multiple reasons for that. And I think NeoGen might have a very important role to play in the future with regards to that. So we do know that plasma has documented antimicrobial properties, and after surgery, I don't want any infection, so that helps me. So with my upper eyelids, I use NeoGen to augment my surgery. I use exosomes to augment my surgery. It tightens my skin. I also use the vector technique that I'm sure Angela will demonstrate later, and Dr. Raj might demonstrate that later as well. We actually give a brow lift with NeoGen, along with the upper bleph surgical procedure, and postoperatively, all of that reduces the irritation and improves the skin quality. So in summary, NeoGen enhances the surgical bleph outcomes. It treats the Preseptal, surgically not the pretarsal area, but we can treat the pretarsal area when it's not a surgical. However, I would urge caution because it's very close to the eyelashes. We do need to avoid the sutures and the medial canthal zone, which I call the danger zone. Stay away from that. Everything else is fine. Use a vertical vector for synergistic lift. Take advantage of its antimicrobial and remodeling properties. And I think that the potential of NeoGen as an augmenting device for your surgery is immense. Thank you very much for your time.
Thank you so much, Prof. Really appreciate it.
There's any question I'm happy to take?
Any questions, guys? What energy are you using, Prof?
1.5.
1.5. Yeah, he normally does 2 passes over the area, yeah. Any other questions? Yeah. So, boss, I don't know if you heard that. The question was essentially, if you're not doing blepharoplasty, you're doing it just obviously without the surgery, would you still cover and protect that inner quadrant that you discussed? And would just like I presume a spatula or something over the top of it, would that be sufficient? And would the boundaries be the same as well, actually, or would it be any different?
No, same. It's the anatomy does not change. It's a very small area, you know, on the inner side. You can almost feel like a loose skin. You need that loose skin anyways. You don't want to tighten that loose skin because that's so important for your tear duct function. It's so important for your expressions. It's so important for your eyelid shape. So there's really no indication to tighten that. And it's protect that tiny thin skin is protecting your lacrimal system. So as long as you avoid that, you can just feel that little inner soft area. You're fine.
Sorry. The 1.6, is it for all skin types? Sorry. The 1.6, is it for all skin types? Is it the wet technique or is it the dry technique?
I use it for all skin type.
Sorry, the second question was wet technique or dry technique? Do you spray anything on before or just dry?
So I have a topical anesthetic cream that I do apply on the skin. If that would constitute that to be a wet technique, then yes.
I wanted to
I'm
ask.
assuming that was your question. I could be. If I didn't understand you, please do ask me again.
I wanted to ask if you have an EVO, do you do more passes?
No, so we've got a PSR device, and so depending on the patient, normally he does a single pass or sometimes he does a double pass.
But if you have an EVO and you're treating the eye,
It's the same.
you can't get to 1.5. You can only go to 0.7.
That's a spa.
The spa, sorry, Dan.
It's okay, yeah. So with a spa, you may need to do multiple passes, yes. Sorry, apologies. I didn't understand, apologies. Yes, that's fine. Yes, that's fine. Any other questions? Oh, yeah, here we go. 1 second, Prof, another one.
Prof said he. You mentioned you held the nozzle 2.5 from the skin. Do you mean the spaces, the legs you hold 2.5 from the skin, or you take the legs off and then?
So you have the nozzle and you have a little thing sticking out. I'll call it the thing, and I just keep that about 2.5 millimeters on top of the skin, and I go over them like that.
And he's using the high energy nozzle. So there's 2 types of nozzles. There's the 25 millimeter, and then there's the 5 millimeter. So he uses the
5 millimeter.
He uses the 5 millimeter one and hovers it just about two. What did you say? 2-3 millimeters above the skin surface.
2.5 to 3.5. I've measured it. I've sort of controlled it. And just a little pearl on the previous question of Evo. A lot of it is, as a practitioner, your own observation. We can all have a cookbook recipe, but we are artists at the same time. We are seeing things happening in front of us. So when the shot goes, you see almost like a diameter of bit of inflammatory change, and that is your range. And you go to the next range, then you go to the next range, then you go to the next range. And very soon you realize that, oh, you've covered it all. This is good. Do I need to go again? And sometimes it is your own judgment call. I do twice. Sometimes I go once because if I feel that's enough. I've never gone 3 times. But in future, if I feel I need to go 3 times, I might do that. Of course, within safety parameters.
Any final question? Oh, yeah, we've got one from Simon. Sorry, guys, can I squeeze past you? Sorry. Simon Jones here, boss.
Thank you, Professor Jeeva. Do you use ocular shields when you're using NeoGen?
No, I did at the very beginning because I didn't believe it, but Dr. Raj made me a convert, and now I don't.
So that's a no.
No, it's a very
Thank you.
very strong no.
Thank you.
And I think that is such a beauty of this laser. But sorry, apologies, as a sin to call it a laser. It's such a beauty of this energy-based device. I do apologize.
So
Sorry,
yeah, no,
sorry.
when he first started, he didn't believe me that we could use it on the eyelids, so he decided to go against my recommendation and use a corneal shield anyway. But now he does not, which is good. It shows that you're progressing and you're learning, Prof, which is really good. One second, hold on. There's another question, lovely lady in the audience. 1 second, hold on. I'm going to pass that down.
Do you not treat people who have had cataract surgery or have had any lens replacement in their eyes with NeoGen? Do you not go over the eye at all?
It makes no difference whatsoever. Absolutely no difference whatsoever.
So it's safe to do that because I haven't been doing that.
Yes. Absolutely yes. It has absolutely no problem. I've done cataract surgeries on my oculoplastics patients, and absolutely no issues at all.
With any energy?
Any. There is no evidence and there is no logic.
Fantastic.
Right, Prof, you better go back to work.
Thank you very much.
Time's a
Nice
ticking.
to meet
Thank
all of
you.
Thank you for your time. Bye-bye.